Okay. So we'll learn why skin health is so much important and why we should take care of the skin. The first and foremost thing that we need to remember is just like we have other organs in the body that perform very vital functions like heart, brain, liver, kidney, or lungs, skin is also considered an organ of our body. It is the largest organ of the body, and that is why it is being given so much of importance since years coming. So we'll discuss about the functions. What are the main functions of the skin? The first and foremost function that we all know is about the aesthetics that it provides to us. It provides a certain aesthetics, certain looks, and which is all, of course, very much important to every one of us. Apart from that, serves many other functions. Like the most important function is it creates a barrier between external environment and internal environment. And by providing barrier, it provides the first line of defense against the external pathogens, external pollutants, and it maintains the health of our inner body. So it is again one of the very important functions of the skin. Now, moving forward, the other important functions of the skin that it synthesizes certain vitamins and certain minerals. The most common being we all know that vitamin D is synthesized in the skin via sunlight. Skin also helps in maintaining the inner temperature, core body temperature. So whether we live in 40 degrees Celsius summers or we go into 0 degrees Celsius winters, the internal body temperature remains the same, and skin performs a very vital part in that. It regulates the inner body temperature and does not make it fluctuate according to the external environment. So due to all these functions, taking care of your skin becomes very much important, and it is why skin health is so much being talked about. Also, skin reflects the overall health of a person. So when a person is suffering from any physical condition or any mental health condition, it tends to reflect on the skin. So skin, we can consider it as a reflection or as a mirror of our internal environment or internal body. So because of all these things, we need to take care of the skin. And I'll be discussing very few important points that we need to consider when we are talking about skin health. It will be mainly related to what products to choose because there are so many commercially available products and what sunscreens, what moisturizers, what face washes to choose for daily care routine. And of course, if you ever have any kind of dermatological issues, always consult a qualified dermatologist. So moving ahead, how a healthy skin looks. What is the definition of healthy skin? So healthy skin is smooth without any breaks on the surface. It is slightly warm. It is neither too cold nor too hot, and it reflects the temperature of our inner body. Sometimes in certain skin conditions, skin tends to get warmer more than normal, and in certain conditions, it tends to get colder. So when it occurs, it indicates there is change or there is something underlying disease progression going on. It is neither dry and flaky nor moist or wrinkled. So it requires a very this balance is very much important because either too dry of skin or too moist or wrinkled skin can lead to certain skin conditions. So when you see the definition of healthy skin, one of the most important points that pops out is it doesn't include color. Now we all have we all have heard about fair uh, fair skin is healthy skin, but that is not the correct approach. Skin health does not depend on color. It can be fair, it can be dark, it can be of any color. So to discriminate with the color of skin or due to color of skin is completely wrong, and we all need to understand this very important thing. Skin, healthy skin or maintaining healthy skin is something that is a lifestyle habit. It is not something that you just take that approach for only for a few months or few days and then you stop it. No, it requires maintenance. It requires consistency. It requires to become a habit, because healthy skin is not an overnight miracle. It is something that comes with regular practice of healthy habits and maintenance. So just like to stay fit or just like to stay mentally healthy, we do certain tasks like going to gym, going for a walk every day, or reading a page, reading a book for half an hour every day. Just like that, skincare is also equally important and it is equally requires to be a part of your daily routine. So these are the basic points that we'll be discussing today about, and these are the points that we need to take care of while taking care of the skin. Moisturizing, protecting the skin against the sun, being gentle on your skin. And as we discussed that we take a holistic approach to your skin health, and it requires a healthy diet and nutrition, management of stressors, management of certain habits or certain addictions, and the importance of self-examination. It is again very much important to see your skin, to examine your skin in a routine, so that if you notice any adverse changes, any changes in your skin, you can immediately consult a doctor. So first of all, we'll start with sun protection. Why sun protection is important? In India, sun protection is mainly important because the UV rays, ultraviolet rays from the sun can cause a faster aging process. It can cause pigmentation on the skin. It can cause tanning, and in certain individuals, specifically in people with fair skin, there are chances that ultraviolet rays may cause skin cancer. So that is why sun protection becomes very much important. So first we'll talk about physical sun protection, how we can wear certain things or do certain things like wearing long sleeve clothes. And when we talk about sun protection, it is always better to wear dark colored and closely woven or knit clothes for best protection, along with a wide brim hat. So the wide brim hat will take care of your face and the clothes will take care of your body sun exposure. This is specifically important when you are outdoors, when you are going on a vacation, on beach, on mountain. This is very much important to wear this kind of clothes and take such kind of physical protections, because you are going to be in the sun for longer periods of time. Now, the most important question and most commonly asked question is how to choose a sunscreen, which sunscreen to choose, and what to look in a sunscreen. So, for Indian skin, a sunscreen that is having 30 SPF, that is sun protection factor, is enough. It's okay if you go higher than that, but it doesn't make much of a difference in the protection that they provide, unless you have certain photosensitive conditions or skin conditions that get aggravated by sun exposure. It is important to choose a sunscreen according to your skin type and according to your body parts that you are going to use for. When you are going to use a sunscreen for your body, make sure that you choose a lotion based sunscreen, because it is easily spreadable and with small quantity you can cover large body parts. It is better to go for a lotion based sunscreen for body parts apart from face. Now coming to face. There are different skin types specifically on face, and why it is critical to choose a sunscreen accordingly, because at certain times some sunscreens can cause acne breakouts. Some sunscreens can cause sensitivity on your face, so it is important to choose accordingly. Now, for people who have oily skin, you you choose a gel-based sunscreen that have the label on them, non-comedogenic. So the label of non-comedogenic means that it does not cause acne breakout. It is it is not causing any kind of comedone. Comedones means it is a type of acne or pimples. And in a broader way, whenever you choose anything for your face, be it a moisturizer or a sunscreen, it is important to look for a non-comedogenic thing, because uh, if it is not mentioned or if it is very oily, it can cause acne breakouts, it can block your pores, and it can cause infections on your skin. So for oily skin, a gel-based sunscreen. For combination or mixed skin, a cream-based sunscreen is good. And for extremely dry skin, again, cream-based sunscreens are very much good. And for people who have sensitive skin, who get frequent reactions to certain makeup products or certain creams, make sure that you choose pure physical or pure mineral sunscreen. Now, coming to physical and chemical sunscreens, these are the two types of sunscreens that are available in the market. Most commonly used are combination types of sunscreens which have both chemical and physical parts. It is most acceptable because they have very good aesthetic value. They don't leave behind any white cast, and at times now there are very special sunscreens available which are very transparent on the skin, and you don't feel like you have applied a sunscreen. Now, physical sunscreens are the best sunscreens because they provide the highest rate of sun protection. Even though SPFs are same, they are more effective than chemical sunscreens. But pure physical sunscreens tend to leave behind certain white cast effect. So if you have seen cricketers or if you have seen sports person, you have seen the white colored sunscreens on their faces. So they are physical sunscreen, and because they don't need an aesthetic look at that specific point of time, it is very much suitable for them. So if your skin does not react to anything, it is okay if you are applying a combination sunscreen or chemical or physical sunscreen. But make sure that if you have sensitive skin, and if you are going for an outdoor trip or playing sports, or you have to stay in the sun for longer periods of time, then choose pure mineral or physical sunscreen. Moisturizer. It is important to moisturize our skin. Now, why it is important? We all have certain natural moisturizing factors that are there in the skin. Our skin automatically synthesizes certain oils that keeps the skin moisturized. Now, we live in certain environment. We live in uh, air conditioner rooms. We live in, if we are into winter or if we are into dry states, dry climate, it tends to make the skin dry. Sometimes some people have internal conditions that make the skin drier, like thyroid disorders, diabetes. These conditions tends to make skin dry. So moisturizers are a must nowadays, and you should be including it in your skincare routine. Now, how to choose a moisturizer? First, we'll talk about face, how to choose a face moisturizer. Same when we talk about, just as we talked about sunscreen, the same applies to the moisturizers too. Like for a face, you choose a non-comedogenic moisturizer. For dry skin, choose a cream-based or lotion-based moisturizer. And for acne-prone skin, for oily skin, you choose a gel-based moisturizer. Now, the body parts, all other body parts have different types of skin. Like face has very thin skin, and it is very much, it has uh, maximum amount of oil glands, so it requires less moisturization. However, our body and our hands and feet, they contain relatively less amount of oil glands. Hands and feet have the least amount of oil glands. So you must have seen that sometimes you feel that your face is oily and your skin on the face is oily, but your hands and feet still remains very dry. So this is the reason why this happens, that the oil glands differ in certain body areas. So when choosing for a cream for hands and feet, choose the thickest moisturizer that is available, so that it tends to stay there for a longer period of time. For body, if you have normal skin, if it doesn't get dry or don't have dry skin conditions, then you can use the normal body lotions that are available. Just a second. Sorry for that. So when we talk about body lotions and body moisturizers, there are so many commercially available moisturizers are there. And if you are using a moisturizer and you are okay with it, then continue with that moisturizer. Now, how frequently should we use a moisturizer? At least 2 times a day after washing your face or after having a bath. You should use a moisturizer. If you are feeling particularly dry for more parts of time, or if you feel that the effect of moisturizer is waning off, then you can apply it more frequently than twice a day. Now, hydration is very much important. Along with moisturizer, internal hydration by taking enough fluids during the day is equally important. Taking 2 to 3 liters of water of or any kind of fluids is important in daily routine. If you're not having any kind of workouts, or if you're not roaming outside for much period of time, at least 2 to 3 liters of water intake or fluid intake is a must. If you are losing water for by any means, like if you are staying outside or staying in the sun for most of the part, sweating a lot, or you are working out, then you might require more water. Also, in sunscreens, we forgot to mention about uh, how frequently we should apply a sunscreen. So, sunscreen should be applied at least twice a day, or at least 4 to 5 hours, 4 to 5 hours. Like if you are applying once in the morning, apply after 4 to 5 hours in the afternoon again. If you are staying indoors or you are not going out or not doing any physical activity. Now, if you are playing a sport or you are staying outdoors or you are going on a vacation, then you need to apply sunscreen every 2 to 3 hours so that you can get the maximum efficacy of a sunscreen. Now, be gentle on your skin. So this is again very frequently asked questions by most of my patients, that how to wash the skin, how to wash the face, how to wash the body, what to use and what not to. So it's okay if you have normal skin, you can use soap or you can just wash it with water. If you have dry skin, then use as little soap as possible. If you want to use soap, make sure that you use soap which is glycerin based soap. Always use cold water or lukewarm water. Very hot water tends to suck up the moisture from the skin, suck the moisture out of the skin. It makes the skin more dry. What to use for face and what type of face wash should I use, because there are so many things available in the market. If you have oily skin, then there are certain ingredients that you should look in the face wash. One is salicylic acid, the another one is tea tree oil. These two are most efficient in oily skin in face wash. It will make your oil disappear, it will make your skin dry. When you have very dry or sensitive skin, make sure that you use a cleansing lotion or a cleanser. Cleanser are just very mild form of face washes. It removes the dirt but simultaneously does not affect your oil glands. So your oil glands remain the same, remain intact, and you don't get your skin dried out. So it is very much important that sometimes people tend to get dry skin in winter and then oily skin in summer. Then it is better to have both the things, that you use a cleanser in winter and a face wash in the summer. Another question that I get asked very frequently is how to do exfoliation, what to use, whether to do it or not, or how frequently we should do it. So for oily skin, exfoliation can be done every week, at least weekly or 10 days. For dry or sensitive skin, it is better to avoid exfoliation because it will just damage your skin more. It will make your skin more and more sensitive. For normal skin, you can exfoliate every 15 days. That is enough. Exfoliating every day can damage your skin. It can damage the uh, skin barrier, and it can lead to certain infections and acne breakouts also. What excessive rubbing can lead to? It is a very common myth that when we bath, we should rub the skin to remove the excess dirt. However, the rubbing for very long time and very rigorous rubbing can lead to certain skin conditions, and it may look like thickened skin, pigmented skin, dried out skin, and sometimes it may lead to oozing and serous discharge from the skin also. And those conditions are very difficult to treat. So make sure that you avoid rubbing your skin when you bath. Simultaneously, if you feel that you are not getting cleaned enough, or without rubbing you are not feeling good, then make sure that you rub with your hands and not with any loofah or any pumice stones, because they tend to damage the skin more. So in a nutshell, always be gentle on your skin, because being gentle on the skin will provide you certain benefits. Now, importance of diet and nutrition. For skin, there is no one thing that we say that you should take this in maximum amounts and you should restrict certain things. So a balanced diet is very much important for a healthy skin. A balanced diet means uh, required amounts of daily carbohydrates, daily fats, daily essential amino acids, daily proteins, vitamins, etc. However, there are certain vitamins and proteins that are important for skin. The most important ones are vitamin A, vitamin B1, B2, B12, vitamin C, vitamin D, so- and there is another vitamin known as biotin. So biotin is specifically for hair and nail. It is very much important for hair and nail. Proteins are again important, makes a very important parts of your hair, and protein deficiencies or vitamin deficiencies can cause hair fall. It is the most common cause of hair fall in Indian population that we see. Always prefer to eat fruits and vegetables in their raw form rather than taking them in the form of juices or smoothies, because along with all the benefits of uh, vitamins and other minerals, when you are eating them in raw form, they also provide the benefit of the fiber, and it is equally important in your diet. Just as we mentioned, adequate water intake is very much essential for the healthy skin. When we get dehydration, when there is lack of water or lack of fluid in the body, there are certain signs that you can notice, like Drying of eyes and drying of lips are the first and foremost signs of dehydration. If you are feeling that your lips are getting dried, or there is constant watering from your eyes, or there is constant itching from your eyes, or there is burning micturition, or you get burning sensation while passing your urine, this might be signs of dehydration. So make sure that you ask yourself if you are drinking enough water or not. So diet and nutrition plays very important part in the health of both hair and skin. For hair, protein is one of the most important things that you should include in your daily daily diet. How certain vitamin deficiencies look like. So vitamin A deficiencies can lead to certain complications on the skin and in the eye both. When on the skin, it it can present as small bumps on the skin, and it can lead to hair fall also. Then vitamin B12 deficiency, it can show as perioral pigmentations, uh, dark circles, and hair fall. Then vitamin D and B12 both, they can trigger certain autoimmune conditions, and they may be responsible for hives also. So make sure that you check yourself for those vitamin deficiencies. One of the most important deficiency that we see in normal practice, and which can lead to severe dark circles and hair fall, is iron deficiency. So it shows as low hemoglobin levels. Specifically, women who are menstruating, they tend to lose uh, uh, blood in the menses. So it is important to get the hemoglobin checked and take the iron supplements as and when necessary and required to maintain healthy skin and hair. So effect of stress on skin and hair. So sometimes we uh, don't realize how important mental health is, or how our mental health can impact our skin. So I'll just give you certain examples that we notice on day-to-day basis, but sometimes we forget to link both of the things. The first and foremost example is when there is a lack of sleep, or when we haven't slept properly. You immediately see there is a puffiness on the face, there are dark circles on the eyes the next day. And like immediately anyone can tell that you haven't slept last night. Now, this is one of the very obvious signs of how lack of sleep or how stress can affect your skin. Another one is when you are preparing for your exams, when you are going through extremely stressful periods, sometimes you get acne breakout. So that is again, it can be due to your increased stress levels. Apart from this, how stress can impact your skin. So when you are in chronic stress, there are certain physiological or hormonal changes that shows on the skin. If you have certain skin conditions, they can aggravate it by the stress. There are certain skin conditions that can be caused by stress, like urticaria or hives, then acne, rosacea, and there are so many other numerous conditions that may be triggered by stress. In hair, when you are in a specifically stressful situation and the phase goes for quite a good period of time, after 3 months of starting this stressful condition, you might experience severe hair fall. However, this type of hair fall is completely temporary, and when you once you get out of the situation, slowly and gradually the hair fall also becomes normal. And not only with mental stress, it also applies to the physical stress equally. That when you have been you have undergone a surgery, or you have been through a very severe illness like COVID, dengue, chikungunya, you may experience hair fall after 2 to 3 months of those periods. And it is completely normal. It is just that your hair is reacting to the physical stress that it went through 2 to 3 months back, because hair cycle is of 3 months. So when the body experiences certain stress, it shows on hair after 3 months. So what can be the signs of stress? So some of the very basic signs I will describe, that lack of sleep or increased sleep than normal, lack of appetite or binge eating or increased eating, increased cravings for food, increased cravings for sugar, then low or depressed mood, or being very much anxious all the day, getting irritated at small things, getting frustrated very frequently. So these all can be signs of stress. Then anger issues or any sudden behavior changes. These all can point to mental health stressors, that you might be having some kind of stress, and it requires lifestyle changes for both mental health and skin health both. So this is how stress can affect. Stress can also result into certain kind of pigmentations, and it may lead to resistance to certain treatments too in certain conditions. Habits and addiction. Now, when we talk about habits and addictions, the most common or mainly our focus gets onto the addictions like smoking, alcohol, or drugs. Of course, they are very much harmful to the skin and hair, both of them. But there are more to our habits, because habits include something that we do on a daily basis or on a routine basis. So smoking can result in certain in pigmentation of skin, in pigmentation of oral cavity, and it increases the aging process. It makes you age faster, the nicotine. Alcohol can cause certain kind of swellings on the skin. Some people have reactions to alcohol, they get urticaria, they get hives after taking alcohol. Of course, internally, smoking damages your lungs, it can cause lung cancer. Alcohol damages your liver, it can cause liver cirrhosis and cancer of liver too. It will not go into that, we are sticking to only skin. Then another habit when it comes is skin picking or nail biting or skin biting. Now, up to certain level, all these habits can be considered normal, or else all these activities can be considered normal. Like if we are watching an IPL match and the match goes into a super over, or if we are watching an India-Pakistan match. In such situation, such tense situation, nail biting or skin biting can be considered normal, because it is at times a coping response, a normal response to stressful situation. But when it becomes habit, then it becomes a problem, because all these things, nail biting, skin biting, or skin picking, or hair pulling also, it damages the skin or hair or nail. And if it is an occasional thing, it gives the time to heal your skin. But when it becomes habit, the skin or your body part that you are picking, they don't get the time to heal. And so it can lead to certain changes like thickening of skin and frequent infections, frequent cuts on the skin. And sometimes people who have habits of picking of skin over specifically hands or invisible areas, they tend to get embarrassed when they are going out. But sometimes these habits are so much firm that it also becomes difficult to leave those habits. So in such cases, always consider consulting a dermatologist. Adequate sleep is equally important. 6 to 8 hours of sleep is something that is generalized. However, some people may have a natural sleep cycle of less than 6 hours or more than 8 hours. It is completely normal. However, uh, if you don't get enough sleep, then it can reflect on your skin in bad way. Exercise is also one of the habits that is very much important. It provides certain chemicals to the skin, and we all know that people post selfies with post workout glows, and believe me, it is real. When we talk about post workout glow, it means that post workout or post exercise, the blood vessels on the skin, they provide more blood to the skin, and there are certain hormones or internal chemicals, they get secreted into these blood vessels of the skin, and it exercise is important for both for skin health and mental health too. Now, use of OTC creams and beauty products. Why this is being included in habits or addiction? Because in India we have an obsession about getting fair. So when we get, uh, so it is mainly prevalent in people who are people who come from lower socio-economical background. They go to the chemist and ask for fairness cream and they start using them. Now these OTC creams or fairness creams contain certain amount of steroids and other harmful chemicals. I would not say harmful chemicals because under supervision when they are used, it is very much beneficial. But when used without any supervision or without any prescription, it tends to harm your skin. So when such use of steroids, when you use such steroids on your skin repeatedly and in a for a long period of time, your skin kind of gets addicted to it. Even though it, even though there are harmful effects on the skin, the moment you stop this cream, the skin will react. The underlying condition can get flared up. So you continue using those creams and it ultimately damages your skin. So whenever you want something, a skin product and with an active ingredient to use, always consult a qualified dermatologist before taking cream for your skin. So self-examination. Self-examination is equally important if you notice any changes on your skin like severe dryness or cracks on the skin or any bumps or infections. How infections can look like they look like a pus filled uh, small folliculitis, or you may get uh, round ringworms. They are all kind of infection. Then sudden development of rashes. It might be reaction to anything and itching. Now, itching occasionally or in certain areas of the body, some in a very mild type, like it is not affecting your routine. It may be there, it may be considered normal, but when the itching starts interfering in your daily routine, it starts disturbing your life, then consult a qualified dermatologist because it is very much important to consult a dermatologist. Yeah. So how skin and hair mirror the internal health? So there are certain autoimmune conditions that can show on the skin, like systemic lupus erythematosus. So it is a condition in which skin gets extremely photosensitive and you get malar rash or butterfly rash on the face. So when you get, or it can be the first sign of certain autoimmune condition. Also, thyroid disorders tend to dry up your skin or make your skin extremely wet. So hypothyroidism leads to dry skin or xerosis, and hyperthyroidism can lead to moist skin. It can also lead to weight gain, and weight gain has all other complications with that. Diabetes, diabetes can cause frequent skin infections, frequent fungal infections. Obesity and increased cholesterol, uh, they can they can lead to the pigmentation over necks, over axilla, and basically pigmentation over skin fold, which is also known as acanthosis nigricans, and PCOD in female. Polycystic ovarian disease in females is a very common condition nowadays, and when we talk about PCOD, it is uh, most of the cases it is associated with increased weight or weight gain. Now, weight gain and PCOD go hand in hand. What are the symptoms of PCOD? Uh, in the patients with PCOD, the acne breakouts are very frequent. They also get pigmentation over neck or darkening of skin over neck. They get thick, coarse hair on their face. They get frequent. They have dandruff or seborrheic dermatitis. They tend to have uh, they tend to have hair fall too because there are hormonal imbalances in the body. Now, for this condition, PCOD, the weight gain is something that is very much required. Sorry, weight loss is something that is an essential part of the treatment along with the medicine. Certain myths and misconceptions about skin disorders. The first and foremost that we talked about, the obsession of being fair or getting fairness. Now, it can lead to so many complications, both mental and over the skin, both in both the aspects. Now, the obsession of getting fair can lead to use of certain harmful creams, certain harmful chemicals on your body that we discussed in the use of certain products, and it can lead to damage of the skin. Apart from that, this obsession may lead to at times into getting frequent procedures. Now there are so many procedures out there. You must be all aware about chemical peels and lasers and hydrofacials. Now those who are obsessed with getting fair, they tend to get this procedure very frequently and in repeated manner, and they never get satisfied with that. So it is important to know that differentiate between getting fair and getting a healthy skin, because the color of your skin or uh, the tone of your skin is very much determined by your genetics, by your environment, surrounding environment, and by the sun exposure that you are getting. So even after all these procedures, applying all these creams, there is only a certain amount of fairness or certain amount of tightening that you are going to get. In fact, it is very much beneficial for Indians that we are of dark skin, or those who have dark skin, they have less chances of developing skin serious conditions like skin cancer, because the melanin or melanocytes that produce the pigment in the skin that are responsible for the color of the skin, they give the protection against the skin cancers in response to the UV light. So the purpose of using the sunscreen in Western countries and in India is completely different. When we talk about Western countries, they have less number of melanin, and and because of that, their skin is fair, and because of that, they have higher chances of developing skin cancer. So they use sunscreen for that purpose. While here, we use sunscreen as an anti-aging purpose or to prevent the tanning or pigmentation. So this is the difference, and this is why how melanin or how dark skin is is act as a protective agent for our skin, for our health. Another myth is all skin disorders are contagious. Well, so many skin disorders are non-contagious, like psoriasis, eczema, atopic dermatitis, vitiligo. All these conditions are completely non-infectious. There are very few that are contagious. So make sure, because this myth can this myth uh, can lead to stigmatization of the person who are suffering with skin condition. We get so many patients that people don't shake hands with me, people don't sit with me and eat with me. They just separate me, single me out. They don't include me in their group, just in the fear of that they will contract the skin disease. So it is important to know the diagnosis of a skin disease before doing this, or before just assuming that all skin disorders can be contagious. Skin disorders are related to food. A few skin disorders are, not all. Now what happens is that so many people come, and because they have already developed skin disorder, they already they have already stopped eating certain kind of food. Now, what this does, it can create certain deficiencies and it can lead to more skin conditions. So, it is important to get yourself diagnosed if you have skin conditions, and ask your dermatologist or doctor, that whether it is related to food or not. Role of past sins and karma. Of course, it sounds very silly when we talk here, but many people have this kind of belief that I did something, I must have did something in my past life, and that's why God has given me this skin condition. Scientifically, totally wrong. Skin conditions have certain etiology, certain genetics, and it has no significance with past sins or karma. Heredity and genetics. Now, this is something that is uh, a little bit complex topic when we talk about heredity and genetics, because a certain condition, not only skin, if you take any other condition, there is always a role of heredity and genetics. However, it is not the only thing that matters. There are so many other things, like if you have any other medical conditions or not, how your environment is suiting you, what products you are using, and how your diet is, how your mental and physical stresses are. So these all come together and give rise to a skin condition. Only genetics is not responsible for the development of a condition. There are so many factors that are affecting in development of skin condition and in persistence of it. So labeling that this type of skin condition have only come due to a certain genes is something of a very generalized assumptions that we are assumption that we are making. So how a skincare routine should look like? Washing or cleansing is the first step. Then you use moisturizer, and then you use a sunscreen. So this is a very basic skincare routine that everyone should be starting with. Once you get habituated with these three things, then you can add other active ingredients into your skincare routine, like night creams or day creams. But these three things are must, and it is the base of any skincare routine. So what are the certain skin products and their roles? Because there are so many commercially available serums and gels and creams that contain all these ingredients. So what to choose and for which indication to choose? For what purpose to choose? So first is retinol. It is very trending molecule nowadays. Now what retinol does is it acts as an anti-aging product, and it reduces fine lines and wrinkles over the long period of time. Again, all these ingredients will only uh, only show their effects when used over a longer periods of time. I heard about claims like get your skin glowing in 3 days or 7 days. Practically, that is not possible. So make sure you don't get misled by such claims. Niacinamide, it can be used for lightening of skin or glowing of skin, and along with it also helps in minimizing the pores. Vitamin C, again, it is a potent antioxidant and it provides a certain glow to your face. Hyaluronic acid is a very potent moisturizer, so it provides a kind of plumpness of your skin. Ceramides help in repairing the skin barrier. So if you have damaged skin, or if you have very dry or very sensitive skin that has resulted in damaged skin barrier, then ceramides can help you with that. Salicylic acid, very much useful for those who get frequent breakouts of acne, frequent breakouts of pimples. And glycolic acid is again for pigmentation, and it is potent agent than niacinamide and vitamin C. So I'll be ending my presentation with this. Thank you so much for patient listening. And if you have any queries or doubts, kindly put them in the chat box, or you can ask them directly. I'll try to answer as many as possible in the best way I can. Thank you so much for listening.